Good afternoon. My name is Susan Sakosha Olson, and I'm from the Consumer Engagement Team here at Blue Cross Blue Shield of Rhode Island. I'd like to welcome you to today's seminar, Blood Pressure on the Rise. At Blue Cross, we are committed to the health and well-being of our members and of our community. It's very important for us to provide you with more ways to stay healthy and to stay active, and to get the information that you need when you need it. With me today are Diane Deely and Eliza Melian. Diane is a registered nurse case manager, and Eliza is a registered dietitian nutritionist case manager. Both of them are with the care management team here at Blue Cross Blue Shield of Rhode Island, and they are passionate about helping members to understand the steps that they need to take to prevent and manage their chronic conditions. And they help them to coordinate their care at any time they might need it along the way. Now, for those of you, if you have any questions or thoughts, please enter them into the chat and we will address them at the end of presentation. With that, I'll turn you over to Diane.
Welcome everyone. Thank you for joining us for Blood Pressure on the Rise. We will talk about what blood pressure is and what contributes to and what is considered high blood pressure. We'll talk about some things that affect blood pressure that are not within our control and things that we can do to bring our blood pressures down to or nearer a normal healthy level. So let's begin. Today, I'm going to share with you tips on how to manage your blood pressure, improve your eating habits, and manage your stress. So what is blood pressure or hypertension? Hypertension and blood pressure are synonymous. Blood pressure is also known as hypertension, and it's a term you might hear your doctor say, or you might read it in your medical records at some point. But hypertension simply means high blood pressure. Before discussing how to control high blood pressure, I thought it would be helpful to explain what blood pressure is. Blood pressure is the force exerted by the blood against the walls of the blood vessels. These vessels transport blood and nutrients to our tissues and organs of the body. If the long-term force of the blood against blood vessels or arteries is high enough, over time it can damage the blood vessels and therefore affecting our blood flow and causing health problems. As far as the brain is concerned, high blood pressure can cause strokes or transient ischemic attacks or mini strokes, if you've heard of those. Vascular dementia and cognitive impairment are more common in people with high blood pressure. Blood pressure affects our eyes and can damage the retina of our eyes, causing blurry vision, loss of vision, leading to blindness. High blood pressure affects our heart. Very often it can, in the end, cause heart attacks, chest pain, or angina, or heart failure. High blood pressure is a major risk factor for cardiovascular disease, along with high cholesterol, diabetes, and smoking. Kidneys. High blood pressure can affect our kidneys as well and can lead to damage, which can be a risk for needing dialysis. High blood pressure can also damage the blood vessels and the outer extremities of our bodies, our arms, our hands, fingers, our lower legs and feet and toes. The reality of high blood pressure. Almost half of adults in the United States have high blood pressure, about 46%, and this number is increasing. By the age of 55, we have a 90% chance of developing high blood pressure during our lifetime. About 1 in 5 adults are unaware of having high blood pressure. It's one of the silent conditions. Most people cannot feel their high blood pressure until it gets very high. And at this time, some symptoms might be headaches, shortness of breath, chest pain, But it's easy to even ignore these symptoms, thinking that they're simply due to a busy schedule or stress or being a little out of shape or getting older, even blurry vision. We can explain that away with perhaps needing an eye exam and a new eyeglass prescription. For a lot of folks, their first symptom is a very serious one, such as a heart attack or a stroke, and sometimes these events can be fatal. Early detection allows you and your provider, your doctor, to come up with an early treatment plan. Risk factors that are beyond our control would be family history. If your parents or a close family relative has high blood pressure, you are more likely and at higher risk to develop it yourself. Age. The older we get, there's an increased likelihood that our blood vessels will lose some of their elastic quality. I'm sure you've heard hardening of the arteries, and that's what can cause high blood pressure. Gender plays a role. Until the age of 64, men are more likely than women to have high blood pressure. At the age of 65 and older, women become more likely. Race plays a role. African Americans tend to develop high blood pressure more often than people of any other racial background. Chronic kidney disease. This is kind of a circle of conditions because kidneys actually play a role in regulating our blood pressure. So if they can be damaged by high blood pressure initially, but if you have kidney disease, um, the kidneys no longer can effectively regulate blood pressure, which again can result in high blood pressure. On the bright side, there are several factors that are within our control. Smoking plays a major role with high blood pressure. It can damage the arteries. Even secondhand smoke increases the risk for non-smokers. So being exposed to secondhand smoke. Being overweight puts an extra strain on the heart and the circulatory system. Diabetes, most people with diabetes also develop high blood pressure. Increased glucose or sugar circulating in the blood does damage to our blood vessels and can help cause high blood pressure. High cholesterol. More than one half of people with high blood pressure also have high cholesterol. High cholesterol levels damage the blood vessels, also known as hardening of the arteries or narrowing of the arteries. An unhealthy diet, especially high in sodium or salt, calories, saturated fat, and sugar, can contribute to high blood pressure. Excessive alcohol. Having more than 3 drinks in one sitting does temporarily raise our blood pressure, but repeated binge drinking or heavy drinking can lead to long-term increases in blood pressure. It's recommended to limit to no more than 2 drinks per day for men and no more than 1 drink a day for women. Red wine is not a miracle drink, regardless of what you might have heard, but the American Heart Association does recommend even red wine in moderation. Sleep apnea is a condition where people stop breathing or their airway closes to a great degree while they're sleeping, causing decreased oxygenation to the blood in the body, which does cause high blood pressure. CPAP is a fancy name for little devices or machines that a person wears over their nose and mouth or just their nose while they're sleeping, and it actually effectively opens the airway and relieves this problem and the effects of sleep apnea on the blood pressure. Weight loss can also help improve the condition of sleep apnea. Stress. Some stress is healthy. Too much may contribute to increased blood pressure. It's important to manage and control stress. Stress can encourage behaviors that actually increase blood pressure, like poor dietary choices, smoking, increased alcohol, and decreased activity. Hypertension is very treatable. It requires the right medications and monitoring to ensure that your medications are doing their job and that you're not having side effects. Improving your eating habits and learning how to manage your stress are also very important in lifestyle habits that can help control blood pressure. So let's talk about what actual normal blood pressure levels are. So the normal level in the green row would be a systolic blood pressure, or the upper number, of less than 120, and the diastolic lower number, less than 80. So this would be considered a person that does not have high blood pressure or hypertension, and your doctor would tell you usually to stick with whatever you're doing because it's working as far as diet and exercise. In the yellow row, elevated blood pressure would be 120 to 129 for the systolic or upper number, and less than 80 for the lower number. Elevated blood pressure, your doctor will probably recommend lifestyle changes to prevent any progression. And you are more likely now to develop high blood pressure unless you do take those lifestyle changes and steps to help control it. The orange row is high blood pressure or hypertension, stage 1, a systolic or upper number of 130 to 139, and a diastolic or lower number of 80 to 89. If you're in stage 1, your doctor will probably recommend lifestyle changes and may prescribe medications at this point, depending on your risk for cardiovascular disease. And the goal would be to bring your blood pressure down below 130 over 80. High blood pressure stage 2 is upper number or systolic level of 140 or higher, and a lower number or diastolic level of 90 or higher. At this point, your doctor is probably likely not only to reinforce his or her recommendations for lifestyle changes, but may order a combination of blood pressure medications to help bring your blood pressure down. A hypertensive crisis would be a upper number or higher, or systolic level of higher than 180, and a diastolic or lower number higher than 120. And this is you would need medical help at this point. This would be a call to 911, especially if you're experiencing symptoms of chest pain, shortness of breath, vision changes, numbness, or weakness. This is considered a medical emergency. So home blood pressure monitoring is something that you can do at home. The myth is I have high blood pressure, my doctor checks it for me, and this means I don't need to check it at home. But actually, everyone should. And there is an over-the-counter benefit on most health plans. You can call the customer service department and see if part of the wellness programs include coverage for a home blood pressure monitor. Um, it's recommended to use an arm cuff. It's recommended over a wrist cuff for accuracy. Um, Testing your blood pressure at home gives you and your doctor a kind of a larger picture of what your blood pressure is day in and day out, and not just in the doctor's office. I'm sure you've heard the term white coat syndrome. And it's important to keep a log of the time of day that you take your blood pressure, and also the time that you've taken your blood pressure medication, if that has been prescribed, and what time in relation that medication is to when you've actually taken that blood pressure. Okay. Bring your log to each doctor's appointment so your doctor can more easily determine whether your medications are in fact the best for you. It's important to check your blood pressure at home because it can also detect a very low blood pressure. If you're feeling lightheaded or dizzy, your blood pressure could be too low. If people that have diabetes, sometimes it's very easy to confuse symptoms of low blood sugar with low blood pressure. Also, it's important to remember the lifestyle changes we talked about. If you were to lose weight or really change your diet to a healthier eating plan and reduce your stress, your blood pressure may come down and your medications for lowering your blood pressure may need to be adjusted. It's also important to bring your blood pressure monitor to your doctor's office at one of your visits so that it can be kind of calculated for accuracy and compared to the level of blood pressure that your doctor's office obtains. It's also important when you check your blood pressure at home to sit in a chair at a table for at least 5 minutes before you take your blood pressure, feet flat on the floor, and rest your arm on the table as you use your arm cuff with the appropriate size cuff to take your blood pressure. Let's move on to medications. Here is another common myth. I was diagnosed with high blood pressure, but now I have lower readings, so I can stop taking my medication. The fact is that blood pressure medication needs to be continued in order to keep your blood pressure in a healthy range and taken on a daily basis. And if you're having concerns about whether your medication is too high a dose or too low a dose, or whether you're getting some lower readings at home or your readings are still high, discuss these concerns with your doctor before making any changes to the amount of medication you're taking, before you make any changes, so that together you can come up with the best plan. Okay. So stopping your medication without discussing it with your doctor puts you at higher risk, especially abrupt stopping of the medication puts you at higher risk for stroke and other health complications. If you experience side effects, as I said, discuss them with your doctor, and together you can come up with a plan. There are many different types of blood pressure medications, so it is not uncommon for someone to take 2 or 3 blood pressure medications so that in combination they can bring your blood pressure down. Also, keep in mind that some over-the-counter drugs, especially decongestants, for example, can increase the blood pressure, and it's important to check with your doctor or your pharmacist before you take anything in that category. Okay. So in addition to taking the medications, lifestyle changes are essential to keeping blood pressure under control. One of the lifestyle changes is improving eating habits, as we've said a few times. So let's hear from our registered dietitian about ways you can start eating healthier today.
All right. We all know that these are not normal times, yet we still have the ability to control several factors that contribute to high blood pressure. Let's take a closer look at the link between our eating habits and our blood pressure. We'll jump right into a common misconception that if you're taking medication, you can eat whatever you want with no consequences to your blood pressure. Now, while a variety of medications can go a long way to help manage your blood pressure, there are no magic pills. For good heart health and optimal blood pressure, it's still so important to also eat well and make healthy lifestyle changes. In fact, while individual medications typically lower blood pressure by only a few points, lifestyle changes can add up to make big improvements. You can take steps now to maintain a healthy weight because blood pressure rises with body weight. So if you're overweight, losing even just 10 pounds can lower your blood pressure. You can start transitioning to a diet rich in fruits, vegetables, and whole grains, and cut down on sodium because a diet too high in sodium can create more work for the heart and put more pressure on blood vessels. And lastly, focus on moderating your alcohol intake because heavier drinking can cause both short and long term increases in your blood pressure. Of course, always let your doctor know if you're making diet and lifestyle changes. because this can affect your blood pressure and your medications may need to be adjusted. Remember, even during a pandemic, you have the ability to start developing healthier eating habits. Can you guess how long it might take before you see an improvement with your blood pressure by switching to a healthier diet? You might be surprised to find out that results are quick, with most people seeing lower blood pressure in only 14 days or 2 weeks with changes like the DASH eating plan. Now, what is the DASH eating plan? DASH, which stands for Dietary Approaches to Stop Hypertension, is a way of eating designed to lower blood pressure by emphasizing healthy foods. The DASH eating plan is not a diet, but a lifelong approach to healthy eating. There are no special foods or complicated recipes. The plan instead focuses on increasing vegetables, fruits, and whole grains, lean proteins and healthy fats like fish, poultry, beans, nuts and seeds, and fat-free or low-fat dairy products. And it limits foods and beverages with added sugars, saturated fat, and sodium. DASH is rich in foods full of minerals like calcium, magnesium, and potassium, which work together with other components in the diet to help lower blood pressure. Note that taking supplements with these minerals does not have the same effect as eating the foods rich in these nutrients. Switching to a lower sodium diet along with a healthy eating plan like DASH can go even further to improving your blood pressure numbers. So let's move on to another common myth. If you're not salting the food at the table or while you're cooking, you don't get too much sodium. While skipping the salt shaker is a great habit, it is no guarantee that your diet is low in sodium. We know that eating too much sodium can lead to increased blood pressure, which in turn contributes to heart disease and stroke and other issues. So where does most of the sodium we eat come from, and what steps can we take now to eat less of it? It may surprise you to learn that only around 10% of the sodium we eat comes from the salt shaker. Most of the sodium we consume as Americans, nearly 3/4, comes from restaurant, prepackaged, and processed foods, including many products that don't even taste salty. So only a very, very small amount actually comes from the salt shaker at the table or while we're cooking. The fact is, over 40% of the sodium we eat each day actually comes from only 10 types of foods. Sodium is used in many of these products to enhance flavor, preserve freshness, and improve texture and appearance. Sometimes foods that otherwise sound healthy may have high levels of sodium. Examples include things like low-fat cottage cheese or sliced turkey meat. And some foods that you eat several times a day, such as bread, can add up to a lot of sodium, even though each serving may not be high. The American Heart Association recommends sticking to around 1,500 milligrams of sodium a day for good health and to lower blood pressure. The average American adult, on the other hand, actually eats more than twice this amount, around 3,400 milligrams of sodium a day. You can talk with your doctor about the amount of sodium that's right for you. So what steps can you take to start reducing your sodium intake? You can lower your daily sodium intake by using the nutrition facts label as a tool to make informed decisions. The nutrition information listed on the nutrition facts label is usually based on one serving of the food. You can use the percent daily value on the right-hand side of the nutrition label to determine if a serving of the food is high or low in sodium per serving. As a general guide, 5% daily value or less of sodium per serving is considered low, while 20% or more is considered high. At the store, you can compare and choose brands lower in sodium per serving, or even consider changing the portion size you eat to further cut down on your intake. Remember, the sodium content can vary widely within the same types of foods. So part of smart shopping involves comparing labels. Different types and different brands of the same foods may have different sodium levels. In the case of these sandwiches, you can cut out more than half the sodium from the first sandwich just by choosing a lower sodium variety of bread, cheese, and deli meat in the second sandwich. It's also easy to see how sodium can add up really quickly in a small meal like this. Now, in many cities, restaurant sales are down as much as 80% as a result of COVID-19, and many restaurants have closed their doors. We all want to do what we can to support our local restaurants, But how can we do so while staying conscious of our sodium intake? When ordering over the phone or at the restaurant, ask whether nutrition information is available, because many restaurants provide nutrition information on their website that you can also look at ahead of time. A good rule of thumb when choosing something to order is looking for a meal with less than 600 milligrams of sodium. Many restaurants are also willing to adjust the amount of salt they add to their dishes, so you can always request a lower sodium version. Consider requesting salty items like dressing, sauce, or shredded cheese on the side. That way you can add it at your own discretion and use less of it. Finally, a great way to cut your sodium intake when dining out is just eating less. Consider saving half your meal as leftovers for lunch or dinner the following day. Now remember, always talk with your doctor first before making diet and lifestyle changes. Extra caution may be needed with certain health conditions or medications when choosing a new healthy eating plan like DASH. It's important to discuss any major changes in the foods you choose with your doctor. In some cases, you may need more careful monitoring of blood work, and in other situations, your doctor may suggest some modifications to your diet or adjustments to your medications. Now let's move on to talking about stress management. Why should we care about stress? We all know that there have been plenty of stressful events the past year, and that's an understatement. Unfortunately, stressful situations can result in the release of stress hormones, which tense up your body and cause your blood pressure to rise. Stress can also encourage behaviors that tend to increase our risk factors that can lead to high blood pressure, like poor diet, smoking, heavy alcohol use, and decreased activity. Learning to manage your stress helps reduce your blood pressure. Consider trying out new positive habits to manage stress and live a more relaxed life, such as mindfulness practices, including yoga, meditation, and breathing techniques, which all show the potential to help improve your blood pressure. Developing and tapping into supportive and nurturing relationships can also boost our mood and improve our coping skills. And lastly, practicing good sleep hygiene and getting regular physical activity can help improve our mood, manage stress, and improve our blood pressure. Now, having a support network is so key to healthy coping. In these times, it helps us stay virtually connected with family, friends, and members of our community, but it can be so easy to forget to reach out. You can check out resources like the Virtual Community Center, which offers a calendar of rotating online events, including classes like fitness and yoga, dance, nutrition, and other fun activities. And don't forget to take advantage of silverandfit.com for free live and on-demand fitness and meditation classes for Medicare members. And of course, right here on your Blue Store Studio Facebook page for daily mindfulness and exercise videos. Thank you so much for viewing this session. If you would like more support in managing your blood pressure or other health conditions, and you are a Blue Cross and Blue Shield of Rhode Island member, please give us a call. Stay safe and stay well.
Wow, great information from both of you. Thank you so much. Wow, I learned a lot. We may have a couple of questions, actually I do, but in the meantime, if other people have questions, please feel free to write them in the chat. And if you don't have time to do that now, on our Facebook page, we constantly monitor the comments and chats, and we'll get back to you with answers. I like what you mentioned, Diane, about our over-the-counter benefit. And that's something for all of our Medicare Advantage members, whether it's Blue Chip for Medicare or HealthMate for Medicare. And people really can utilize that not only to get a blood pressure cuff, but maybe a scale that will help them with their weight control. So that was a really good point. The other thing I thought about was the stress in my life and how I should better management. So you made some good tips there. I also want to let people know that our your Blue Store Studio has classes Monday through Friday at, at 10 a.m. and at 2 p.m. And you can take those at any time you'd like if you want to. Later on this week, we have a seminar on Thursday at 11:30, And it's about a fitness tracker, kind of like a Fitbit or an Apple Watch or a MaxBuzz, and how to choose the best one for you and then how to use it. Next week, we also have a couple of more educational seminars, so we hope that you would join us. And I'm going to check right now to see if we have any questions in the chat. And we don't. So keep in mind, if you have questions again in the future, please feel free to enter them on our Facebook page. And have a wonderful day and stay warm.